Amy off today, Josh?
She's not, she just, sometimes doesn't like to join us in the conference room.
I literally saw her as I came in here, but I guess,
There she is.
I'm here. One, I'm not really a morning person, and two, I'm feeling under the weather, so I'm secluding myself in the office.
Thank you, Jamie.
Appreciate that.
Let's just keep it that way moving forward.
Sorry to hear you're not feeling. One, not feeling.
Oh, that's me, my bad.
It's fine, you're here. You can count. All right. Well, we will go ahead and get started. Val Yazel, our chair, is hoping to join us, but she had an 8 o'clock meeting that she anticipated might run a little late. So I will help us get rolling, and we'll get started. So thanks for joining us this morning for the first general membership meeting of 2024. So we appreciate you all being here today and being a part of this. Just as a reminder, our plan for 2024 is to have these meetings every other month. So today, obviously our first one, our next one will be in March. And with that, why don't we jump right into it? Maybe. Let's see. There it is. That was a little bit of a delay. We'll call the meeting to order at 9:03 because that's what we do. And the first order of business will be the minutes from our annual meeting in November. And the minutes were sent out with the agenda, and we'd entertain a motion to any comments or a motion to accept those.
I'll make a motion to accept.
I heard Jane with a motion, and I believe Dave McDonough with a second. All in favor, could you indicate with an eye, a thumbs up, a wild waving of your hands? Any of those things would be acceptable.
Aye.
Aye. Aye.
Any opposed? All right. Well, from there, we'll launch into our first order of business, which is to walk through our strategic plan strategies and to talk about some goals, some updates to the strategic plan for 2024. So we've now hit the end of the first year of the strategic plan implementation. So a little bit of review potentially is helpful for everybody. The strategic plan had 4 core strategies. The first was to create new supportive housing opportunities to help people end their homelessness. The second was to improve the effectiveness of our system and connecting people to the services and support they need. The third is to increase partnerships to improve access to healthcare, jobs, and to provide support through transitions from other systems, such as healthcare, public safety, foster care, and other systems. The fourth is to develop local infrastructure to support growth and improvement in the homelessness system and to meet the goals of our plan. So what I want to do, and I put a few slides together in hopes of not going on for too long, but we want to take a look at some of what occurred in 2023. And then for each of these core strategies, we have some goals for 2024 and some strategic direction. And what we really would love for you all this morning, as you think through this, is to weigh in with any thoughts that you have. Our plan from here is to issue basically an annual update to the strategic plan, and then obviously keep working to reach the goals of the plan. So we'll start with strategy 1. Strategy 1 again was to create new supportive housing opportunities to help people end their homelessness. This strategy really, it's sort of focused on the three-legged stool of supportive housing. So one component of this is physical units, apartments, housing that we can help people get connected to. Another part of the stool is the supportive part of supportive housing, so case management services, access to behavioral health and other services that folks need. And then the third one is ensuring that we have funding for rental subsidies so that we can help ensure that people have time and space to stabilize in that housing. So, you know, without trying to go over the top, you know, throughout 2023, one of the things that we did is put out quarterly reports each quarter that kind of went into more detail about, you know, various things that happened. So in this slide deck, just really try to hit some of the biggest things. The housing task force was developed. That's one of the things that the strategic plan calls for. We'll talk more about that in terms of goals, but basically that task force is meeting to say, particularly when it comes to the development of units, how do we support the development of more affordable housing units in our community, which with a special emphasis on ensuring that we have units that people exiting homelessness have access to. Through Heartland Continuum of Care Housing Navigation Services, which you could also read as the Heartland Continuum of Care Housing Navigator, which you could also read as Nick Dodson, recruited new landlords to work with supportive housing programs, developed a strong partnership with the state of Illinois State Referral Network, and administered the Landlord Risk Mitigation Fund. We could have Nick give a whole presentation of his work, and we should do that in the coming months. But the availability of housing navigation services is a significant success of one of the improvements to our system over the last couple of years. The Park Avenue apartments were opened in November. The Park Avenue apartments will provide housing for 33 people when fully filled, and they'll do that through the coordinated entry system. And that's significant for many reasons. It's the first time our community has had an IDA PSH funded development in quite a long time. And it's the first one that will house people through the coordinated entry system. So to have those units come online this year is a really significant development for our community. Heartland Housed also supported a developer's effort to apply for new IDA PSH funding in hopes of developing additional units in the coming years. Springfield Housing Authority, through the Move to Work program, has put in a grant application that would allow for new pathways to housing be created through a Moving On program, and also has applied for the ability to create a voucher program that would mirror the emergency housing voucher that helped upwards of 50 people in our community exit homelessness or homelessness programs into stable housing. And then through funding that was allocated through the Heartland Continuum of Care, whether that's federal money or state money, 142 new supportive housing opportunities were funded, or at least funding was allocated for those in 2023. That more than doubles what was available in our community prior to that. All right. As we look towards 2024, our goals, really part of it is really focused on, as a community, how do we ensure that we're continuing to create more affordable housing? As we create these supportive housing opportunities, we want to make sure that there are quality units in our community that we can help people get connected to. We are working to develop a partnership with the Local Initiative Support Coalition to build development capacity in Sangamon County. And through that partnership to pursue grant funding for training for the community and staff to create new affordable housing initiatives. We're working with community partners to apply for IDA's Community Revitalization Technical Assistance Program. Through that program, we'd study current housing stock and work towards developing plans for additional affordable housing. through Heartland Housed. Once we receive 501c3 status, we plan to develop a local fundraising initiative to create great local grant funding to support the creation of additional permanent supportive housing and rapid rehousing units to help meet the goals of our strategic plan. And then as we look at that housing task force, the goal of that is to grow that and continue to support those efforts. We are working with and anticipate the launch of the City of Springfield's Home ARP funding program in 2024, which we'll talk a little bit more about the goals of that, but that will be a significant opportunity for us as a community to develop more permanent supportive housing opportunities. So you'll see with the strategic plan goals, the strategies 1 and 2 have the bulk of the information. 3 and 4 sort of taper off a little bit. So I promise I won't talk for another 30 minutes on all this. But on the second one, which is a really significant one, improving the effectiveness of our system, our crisis response system, and connecting people to the services and support that they need. One key part of that is our coordinated entry system. We worked with Homebase to do a full evaluation and assessment of our coordinated entry system. And then through the action steps of that, we've amended our policy, our prioritization tool, and we've begun the process of making other improvements to our coordinated entry system. Some of you may have seen that the ribbon cutting for the new Helping Hands facility was yesterday. Helping Hands we'll talk a little bit more in a few moments about that transition and where they're at. And I look forward to all of you at some point having an opportunity to see that facility, which is a significant step forward for our community. A big emphasis in 2023 was street outreach. There are very few staff in our community that are fully devoted to street outreach. Jamie and our team in particular has been leading street outreach efforts and working to pull together various partners who are doing street outreach in our community. We also collaborated with the Springfield Police Department's SEED program and continue that. Jamie's been working closely with the St. Aloysius Collaborative Homeless Ministry, and we allocated funding to Helping Hands to create a new street outreach position. So all of these, not mentioned here is the Springfield Police Department's homeless outreach team. So Officer Newman and Shannon as the community care coordinator are a key part of the street outreach task group, and street outreach efforts. But all of these are key partners in terms of further improvements to our system. We worked with Homebase again to create community standards for permanent supportive housing, street outreach, and emergency shelter. We are finalizing those in anticipation of the Continuum of Care Board adopting those. So that's another key development in 2023. And in 2023, we developed a housing problem solving strategy that works with new diversion programs, our existing homelessness prevention program, and then new programs that we aim to create to really focus on helping ensure that there's pathways for the experience of people's homelessness to be as short as possible. So that's a new part of the system that we're working to build out in some additional ways. Some goals as we look forward. A team of folks from throughout our community are participating in Reinstitute's 100-day challenge. Through that process, which will start in early February, we'll set goals around how to address unsheltered homelessness, and we'll work during those 100 days with technical assistance in a pretty intense way to try to reach those goals. We've begun a process of working with Community Solutions Built for Zero technical assistance with the goal of reaching what they call quality data. A lot of this is deeply connected to street outreach efforts and the development of a by names list of all people experiencing homelessness in our community. So those are all key goals for this year. We anticipate launching the Heartland Housing Helpline. You certainly will hear more about that likely at the March meeting, and have extended, we anticipate adding a new person to our team in the Heartland Housing Helpline specialist position here in the coming weeks. So we're really excited about that development. A community goal is to continue to increase street outreach staff, and in addition to that, increase the level of utilization and street outreach efforts of our homeless management information system. As we develop the community standards, our next goal is to, again, get those approved and provide training on those. And then a key goal for us is to increase the level of training across our community for case managers and other partners on best practices, community standards, but also on local initiatives and local programs to ensure people have good information about what exists in our community and how to access it. And then I mentioned earlier the City of Springfield Home ARP funding. We aim to use that funding to create a housing surge for people who are meet the definition of chronic homelessness, and really focus on creating a housing surge that would really connect people to permanent supportive housing here in the coming year. And then we want to help expand the availability of mental health and behavioral health services that support both the emergency shelter system and those placed in housing opportunities. I think this shows up in the next strategy as well, but this space is one of the key concerns we hear from partners as we try to grow programs and scale new supportive housing programs. So that is one of our goals as well. All right, I promise that's most of it. All right, we got 2 strategies to go. It'll be less painful. See, it's even all on one slide. Strategy 3, when you look at the strategic plan, there are more action steps in strategy 3 than any of the other strategies. And this is one of the spaces where I would say we have probably the most work to do still moving forward. In 2023, we received grant funding to develop a medical respite pilot program. We actually received a second round of that funding too to help us move towards implementation. And so when you look at 2024 goals, we anticipate launching a medical respite care program this year, and hope to even do that in Q1 of this year. We have several task groups and councils that are really trying to work across some of these different sectors and systems. The Sangamon County Reentry Council really works to try to support returning citizens and programs that try to support people who are returning to our community. We've developed a discharge planning complex care task group. That group really aims to sort of improve what happens from a discharge planning standpoint in our community, increase networking between our agencies and partners who discharge in our community, and recognizing that the most difficult part of discharge planning often involves complex care, people who are dealing with a variety of complex challenges in their lives, which might make them ineligible for various programs, which then makes discharge planning more difficult. So that group is really kind of wrestling with that and trying to figure out ways forward. The Medical Respite Steering Committee is again working to launch that medical respite care program. And then in 2023, the Youth Homelessness Task Group has worked and looked very seriously at potential grants that could help us really fund the development of that part of our system, which historically has been very underdeveloped. So as you look at the goals for 2024, we also anticipate applying for grants that would make staffing, training, and other initiatives possible for our community to improve what's available around youth homelessness. And then, as I mentioned, building capacity for behavioral health services. And again, when we talk to partners, when we talk in that complex care space, inadequate community services for treatment, psychiatric care, and mental health services are frequently elevated as a high priority for service providers. And then workforce development. As we help connect more people with housing opportunities, we are wanting to expand what's available in terms of partnerships to help people use the gifts and talents they have in the workforce in our community. So that is a new task group that we anticipate building this year. All right, strategy 4. Strategy 4 is really, when you think about it, it's kind of the back end, the boring sort of system side of it, which in our community, Heartland Housed as an organization was created to really support the work of the Heartland Continuum of Care from a staffing standpoint. We developed a strategy board that really is, the goal of it is to focus on the strategic plan, hear from the Continuum of Care board, what needs exist in our community, what funding is needed, so that those partners can work, to ensure that we as a community are going after resources that can help make sure that we're not just dreaming about new programs, but that we can actually build them. Our team supports 5 full-time employees. So Jamie, Madeline, myself, Heartland House also contracts with Helping Hands for Nick Dodson services as our housing navigator, and contracts with Mercy Communities, who serves as our HMIS lead, for Tracy Cunningham as our HMIS administrator. And then we anticipate a 6th teammate joining in Q1 of 2024 for that housing helpline. And incredible development this year. In 2022, our community, through the Continuum of Care programs, received a little over $647,000 in funding. In 2023, that number more than tripled to over 2.1 million. The bulk of that had to do with new state of Illinois initiatives that led to new funding for our community, especially for rapid rehousing and permanent supportive housing. Some of that had to do with our community receiving additional HUD funding for the first time in over a decade. So we're starting to see that grow, which we desperately need it to grow. But the state of Illinois, the new state of Illinois initiatives were a tremendous component of that. A lived experience collaboration policy was established, and along with that, funding to compensate people with lived experience for their involvement throughout our system, as they work with us to improve our crisis response system and all the things that we do. And connected to that, a youth action board was developed, again with an emphasis on lived experience, to help us really think through the homeless, the youth homelessness initiatives that we're hoping to build. In 2024, through the Community Solutions Built for Zero partnership, we anticipate the launching of community-facing dashboards that would provide you all as partners and our whole community with information about inflow and outflow into the homelessness system, as well as other things. We anticipate, we've had lived experience focus groups monthly over the last several months. We anticipate in 2024 launching the Lived Experience Advisory Board, which it will be a board of people with lived experience who will weigh in on policies and strategy and various things. And also we'll kind of take leadership of focus groups and other initiatives in our community. And then, as I mentioned, as we pursue 501c3 status, one of the things that we continue to recognize is that even as funding has grown in the community, it's still not adequate to meet the level of need we have in community in order to reach the goals we've set in the strategic plan. And so we as Heartland House anticipate a fundraising campaign that would allow us to grant out funds to create new supportive housing opportunities. So that also is a part of the goal for 2024. So I know there's a lot there, but would love to hear from you all, things you saw that you liked, things that you didn't see that you would like to see. What here would you like to weigh in on this morning?
Josh, I think it's remarkable all that you've listed and what this group has accomplished. And I tip my hat to everybody's involvement in getting so much done. And I think it's great that Springfield community is moving forward so much, and that we're able to help so many more people. So congratulations to all.
Thank you, Dave.
I, of course, am thrilled to see us moving forward so much since way back when Josh first started. So I'm always here supporting and helping where I can.
Appreciate you, Jane. I'll mention too that we will send these slides out along with the recording of this too. Those slides will give you an opportunity to kind of read through that some more. So even if you're still chewing on some of that, or even if you just don't want to throw something out publicly, you certainly will have an opportunity to kind of weigh in and add your thoughts beyond these moments here. I think that's enough awkward silence. So we will keep cruising through our agenda here. And I would the next item on our agenda is the Helping Hands emergency. I'm sorry. Did someone want to throw something in there? Might have just been accidental. Laura or Renetta, anybody from your team, if there's anything that you would like to share about the emergency shelter transition, we'd love to give you some space to do that now.
All right, well, this has been a busy couple of months at Helping Hands, as you all know. We did just move into the new facility. We opened our emergency shelter on January 4th, and we just moved our administrative offices and programs over on the 16th, and then had the ribbon cutting yesterday. So we are still kind of getting settled, but we're excited about the opportunity to really launch our housing programs from here. I was thinking through everything that you shared, Josh, and it just really feels like this last year we've built the infrastructure. We've got the foundation, and now we can just really launch. So with that, I know on Friday we're going to be doing a big coordinated entry push, so that in February and March we can really focus on getting people into housing opportunities quickly. One of the areas where we have kind of a bottleneck as far as just staffing is our moves. So I don't know if everybody knows, but right now Tom Gerard is the primary mover for Helping Hands. So all of the people that we move into housing, he and a small group of volunteers do all of the furniture moves. So as we kind of gear up and start this push, if anybody from any organizations would be interested in volunteering to be part of those moves to help people get their furniture and their fresh start in their apartments, we would certainly welcome that.
Well, great, Laura. We appreciate that update. We appreciate all the work that has gone into this on behalf of Helping Hands with just a tremendous effort from you all. So we thank you for that. I imagine there probably are, I'm sure there's questions, and I know that you've been fielding questions and things like that. And so I believe you had mentioned too that kind of like a frequently asked question document or something like that could be in the works here soon too, as you kind of settle into the transition maybe.
Yes, so I did do, I answered some for Memorial Behavioral Health, I think sent out a questionnaire. And so I'm kind of in the process of putting all of the different questions that we're getting on a regular basis together so that I can send it out to the Continuum partners. It is 24/7. We do try to get everybody in by 9 if they're coming after that, or they're not coming on the shuttle. We ask for heads up or an escort. We do have transportation set up. We've got the SMTD stop right in front of our building now, and then we're running the shuttles from 2 to 10 p.m. Just to try to get anybody in. It just so happened that our first couple of weeks happened with the coldest of the year, so we've been packed. We have been running about 115 to 120 a night, during the cold days, we were at about 110 during the day. So we've just been very stretched, I guess we'll say, as we're transitioning in. I did see the question about bus line. It is bus 6. And the night bus stops at right in front of Southeast High School. We do have a shuttle stop there, so we're picking people up there and bringing them into the shelter.
Excellent.
Actually, could I ask Laura a question?
Of course.
Laura, if there's a way you could get me something about the transit information, I can really get that out.
Sure.
Okay, thanks.
Yeah. No problem.
My slides are hanging up here, so thank you for that, Laura. I think I've launched through the next agenda item, and now my keynote's not responding, but basically an announcement that on Monday evening of January 22nd, we'll be conducting our point in time count. Oh, now it's going back. So I know several of you on this call have volunteered to be a part of that. If you're interested in being a part of it, do feel free to reach out to Jamie and I. Will be happy to give you the video of the training and get you more details. We'll go from there. So want to let you know that's coming up. And then the next item on the agenda is we kind of mentioned in the strategic plan presentation that really doing everything we can to provide additional training and more training for community members is a high priority for us. I don't know what's happening with this presentation right now. So with that in mind, we are creating 4 supportive housing learning labs throughout the first half of 2024. We had hoped to do the first one last week, but weather prevented our trainers from making it to town from Chicago. So our first one will actually be in February. We do have a registration link with that we're sending out in the general membership email. So you should have seen it, or if you haven't seen it, do pay attention because you can sign up there. The trainings will be from 9:30 to 3:30, and we'll be providing lunch too. So they're free to community partners. There's no cost. And we'd love for as many folks as possible to participate. With that, our other business, are there any of you on the call, are there updates in your agency that you'd like to provide to the general membership?
I can tell you, we're looking for an weatherization assessor. The job description's on the county website. If you know anyone who has HVAC or construction knowledge, we also put them through an extensive 10-week certification process with the state of Illinois. They don't pay for any of that. They will end up with a state certification. And we also have tuition reimbursement. So if they up to $15,000 that they could receive as well if they're selected for the position.
Excellent. Thanks, Dave.
Hi, I would like to say something, please.
Absolutely.
Thank you. My name is Monty, and we have the Ollie House, and it's really new. We just received 2 gentlemen. So the Ollie House is a single-family house, 3 bedrooms, 1 bathroom, and it's shared with 3 men. We decided we were going to do the first genders that came available, and they just happened to be men. So each senior, and it's a home for seniors, 60 years and older. Each senior will have their own bedroom, and they will share kitchen, living room, and bathroom. The home is fully furnished. We had everything donated in the home. So each bedroom has a full bedroom set. The living room has 3 chairs, TV, There's a stove, refrigerator, washer and dryer. And then we do offer some case management. So once a week, we do take the gentleman, we call that errand day. So if they have we like to schedule doctor's appointments and things that needs to be done outside of the house on one day so we can get everything done. It's not staffed 24 hours, so there is somewhere there 3 times a day. They provide their own personal items and food, but we do make sure that they have 1 cooked meal a day. So with the food they provide, we do cook 1 meal a day for them. It is a room and board situation or accommodation, shall I say. So we ask that the gentlemen are pretty self-efficient on their own. But like I said, we are there to assist them. What else can I say about? We currently have 2 residents, which means we have 1 bedroom open for a senior. And that's about it. So thank you for having me.
Hi, Monty. This is Tracy. Can I ask you a question about your house?
Yes.
You say it's for seniors. Are these just random seniors, or are they for strictly homeless seniors, or?
So our focus is seniors who are homeless, seniors who are facing being homeless, or seniors who are in an abusive living situation. Seniors who may be recently released and have nowhere to go as well.
Gotcha. Thank you.
You're welcome.
Monty, I know that that you have like a flyer and some other information about Ollie House too. If you have a link to that, feel free to throw it in the chat, or if it's a PDF and we can put it out in the general membership email for folks to kind of have your contact information and all of that too.
Great, thank you.
Yeah, no problem.
Monty, do you work closely with senior services?
No, I've tried to get in with connection with them and I have not. Helping Hands, I'm working closely with them, their payees. That's how I've received the 2
Nice.
residents that I do have, but I haven't been able to connect with anyone at senior services at this time.
Well, if they're low income, they may qualify for a lot of senior services different programs. So especially their care coordination unit. So I can message you their number.
Great, thank you so much.
Sure.
Thanks, Amy. Okay. Similarly, if there are other updates or announcements, we'll give you a little space for that. And then why don't we just open the floor too? We'll open the floor for any public comments, any concerns, anything that you would want to share this morning.
Actually, I'm just interested in how many of the Park Avenue units are filled.
I believe we have all of the 1-bedroom apartments filled, and I think 2 of the 2-bedroom units. That's kind of been one of the barriers, and we'll have to work through this, is pairing people up for the 2-bedroom apartments.
Okay.
So we have people who are happy to move in, but the idea of sharing a 2-bedroom unit is sometimes a barrier for them. So we're still working out the kinks on that.
Thanks, Laura. All right. Well, if we have nothing else, we will free a few moments back up in your calendars. But we do really appreciate you all and your collaboration and the work that's going on, and you all being here this morning and being part of it all. So. As I mentioned, we'll get the video of this out. We'll send out the slides as well. And then if you have any questions or concerns, please don't hesitate to connect with us. Our next meeting will be in March, March 21st at 9 a.m. And supportive housing learning labs will take place in February. We'll definitely have a lot of trainings and things coming up in the meantime. So thank you all again, and we'll look forward to seeing you all soon.
Josh, you got a minute?
I do.
Once everybody's gone, that is.
Hey, Ricky. Oh, I'm saying something.
Is it still recording?
Tracy,